All right, today we've presented a comprehensive, funded nationwide plan for actions around supporting our health workforce and growing it over time. Very happy to take your questions.
Why is it important to get to the bottom of what the holes are in our workforce?
Well, just like in medicine, you can't start the treatment until you've got the diagnosis right. So we need to know what our gaps are. Some of them are confronting, but until we do that, we can't make the progress we need to fill them.
Were the gaps worse than you're expecting?
This problem has been decades in the making, and we've heard from our health workforce that they're under pressure, so no, I'm not surprised.
What are some of the, you were a doctor yourself, you've got some more stories and short. What points in the plan will address those things that you had to go through so that others who are training and are in the sector also don't have to go through now?
Our workforce is under pressure with shortages, so we need to support the people in our system now and promote their well-being. That means everything from when you're on night duty, we'll now make sure that there is nutritious food available for you. It means that when something distressing happens at work, we need to be there with the appropriate debrief for you. I had an experience when I was a junior doctor, my first patient who died on an arrest. There was no one whose job it was to speak to me about that experience. Now, for some people, that makes the difference between staying in the health sector or driving burnout and leaving. We want our workers to be better supported.
Minister, does this plan include paid placements for nursing students?
We're really scaling up our efforts to support people to earn while they learn, and there are plenty of opportunities that we'll pursue through that with the plan. There's a number of initiatives, including scholarships and better funding for people to work while they're on the job and study towards nursing and midwifery careers for that.
How much input did Māori have in this plan?
This plan is co-designed between Te Aka Whaiora, the Māori Health Authority, and Te Whatuora, and a core part of it is that we want to see more Māori and Pacifica working in our health system.
How are you going to plug those gaps?
For Māori and Pacifica. Yeah. A key thing is to make sure that we're building a pipeline all the way from high school, encouraging Māori and Pacifica students to study science subjects at high school so they have the background in order to do that in tertiary study, making sure that we're supporting tertiary students so that they don't drop out, working with education providers to give them the pastoral care that they need to stay in the system, and then once they're in the system, supporting their well-being.
There are gaps across many different sectors. Which ones concern you the most?
Look, the whole workforce, it works as a team to look after our people, so I won't single any one out. We need concerted action on all of them.
Not midwives?
There are particular challenges now with midwifery that we need to work really clearly to address.
How difficult was it to get the true data from Māori? How difficult was it to get real, true, relevant, appropriate data from Māori?
There are gaps across the health system in terms of our knowledge of the workforce and including the diversity of our workforce, but we are committed to making sure we grow training opportunities for Māori and Pacifica.
And what aspects of the plan do you think will be most effective at keeping people working in the health system?
At retention. As I said, right now we need to focus on the wellbeing supports for our staff, but also show our staff that we are making progress. We've grown the number of nurses by 1,000 in the last 18 months. Our international recruitment is actually quite strong. We are making progress and we have a plan to address the long-term challenges.
What would you say to people who have recently or in the last few years left the health workforce now and to attract them to come back? What would your pitch be?
Yeah. The pandemic was an incredibly challenging time for health workers in New Zealand and across the world. We're building a national health system now that is going to be a place where we support our workers better and we make long-term action on the gaps that we face. We want to support our workers so that they can do the excellent job they do caring for New Zealanders.
Minister, why have the gaps got so large and why has the health system been so unattractive to people to enter?
I loved working in the health system, Michael, and it is a place where about 10% of New Zealand's workforce work in our health system. However, we do want to grow that. The gaps have emerged over decades, and we have grown the health workforce 16% growth in nurses, 16% growth in doctors during the term of this government. However, it's not enough to keep up with the population, the ageing population and the new demands we need, so we have to do more.
So you are forecasting a 13,000 shortage of nurses, 5,000 shortage of doctors by 2032. I mean, these are huge numbers.
That's right. So when I came into the portfolio, I saw how much the professions had grown, and yet I was hearing stories about all of the shortages. That's why we did the modelling, to check where we were at, and this is showing what we need to do now.
You've spoken about sort of unique diagnosis. What's your diagnosis of the health system?
Need more growth.
And also one of the other things, sorry,
What would you say to people that were maybe turned off from entering the health system? Are you saying it's changed, it's going to be a new system, it's more culturally complicated?
It is all of those things. We want to build a national health system where people can care and are proud of the care that they can deliver for their patients, where they are supported to do that important job at work. And today we have set out a pathway to getting there. Some of these issues we can address right away. We want to bring food into our workplaces to recognise that our night staff are doing great work. However, some of the other issues about gaps and about culture will take a longer time to change.
And I'm not sure this is my question. In your mind, is this one of the fruits of a nationalised health system that you're able to come up with?
There are a number of actions we can take now that we couldn't take when we had 20 DHBs competing against each other for staff. In that old system, it was nobody's responsibility to address the training pipeline. Now we recognise that is the health system's responsibility, and we're working hard on it. That led to the announcement of the 830 nursing placements yesterday.
How much do you think that shortage at the moment is affecting quality of care?
It's really hard to know, but I certainly know it is putting pressure on our staff, and that is why we have to take these issues seriously.
How will you address international competition? There's always going to be people trying to go overseas. How do you get them back?
Yeah, well, firstly, we have made significant progress through immigration in just the last year. We have 1,000 more nurses working in our health system than did 18 months ago. Our getting people through under the new immigration settings is going quite well. Sorry, I've forgotten the second part.
So New Zealanders going overseas to work, getting them back.
Yeah. In some cases, international experience is what we want from our health professionals. I did my fellowship in Singapore and sought to bring my experience back home. But we need to join that up better. So currently, New Zealanders returning to New Zealand can't access relocation costs. We have to fix that. We also could offer people going overseas for their international experience a job to come back to in New Zealand. Another thing we can do because of our single joined-up health system.
Māori have always complained about the health system, but after looking at this data and saying that it is not the true data, that it was difficult to get data, would you agree that the health system is a model for all New Zealanders, not just Māori?
The cornerstone of the Paiora reforms was bringing a te tiriti approach to healthcare. That's why we have created the Māori Health Authority. The Māori Health Authority is part of fixing these issues with our workforce. They contributed to the plan, and continuing the work of the Māori Health Authority is an important priority for this government.
There are also plans to target United Kingdom, for example, to try and bring over more senior experienced medical staff. Can you tell us a bit about that and what gap they will plug?
Our international recruitment is going well, but we still have gaps in some of the senior parts of our workforce. We can make sure we're stationing people overseas to be able to support recruitment efforts for particular specialists we want to bring home. If you're a specialist going to a conference in the UK, you might hook up with our international recruitment officer in London and then go to the conference together to identify people you want to bring to New Zealand.
What type of specialists are they, or what type of professions would be looking to bring out senior UK people for?
We know a priority for our international recruitment is those particular subspecialties, particularly senior medical specialists.
Minister, how critical is it for retention that students are paid while they're training?
We know that financial pressures on students is a reason why some don't continue with their study, and that is such a waste of the training that they've often had. So opportunities like scholarships, like funds to support them when they encounter hardship is a key aspect for turning that around. In addition, we'll be building more earn while you learn opportunities. These have been piloted in Auckland. People who, for example, are assistants on the wards can start to do training in order to take up nursing roles on the job.
I have some questions on behalf about diabetes. A new Chinese study has found that the number of children with diabetes has spiked 40% over 30 years. Is that concerning, and is the government doing enough to combat the disease? For example, could you be funding continuous glucose?
I'm aware that Pharmac is considering a proposal around continuous glucose monitors, and they'll be making a decision on that shortly.
And are you concerned about sort of the increasing number of diabetes?
Yes, diabetes has a big impact on people's lives, and I am aware that there has been an increase. Wasn't aware in China though.
Just to minister all the changes, reforms, the pandemic, it's a huge upheaval for the health system. Are you asking too much change too soon? Is there any risk of that?
I hope people will see. I hope people have heard the pressure that our healthcare workers are under and know that we have to make these changes to respond to them in order to support them to do the job only they can do, which is care for New Zealanders. Thank you very much.